And welcome back to The Factor Uncensored. The Department of Health and Human Services is working on a report that may link Tylenol and certain vitamin deficiencies to autism. That's despite scientists saying there is no credible evidence Tylenol causes autism and it is safe to take during pregnancy. Now, the Wall Street Journal reports RFK Jr. suggests a medicine derived from folate or vitamin B9 can be used to treat symptoms of autism in some people. Experts warn autism is complex and cannot be blamed on a single medication or vitamin deficiency. Joining us to talk about it, pediatrician Dr. Sharifa Glass. Glad to have you here on The Factor Uncensored.
Thank you.
There's so many questions about this and so many, concerns that we're in dangerous territory when we're talking about what causes autism in less than 6-7 months in office for this health director. Your thoughts about this conclusion or possible conclusion?
Well, everything right now is based on speculation in regards to what the report will say. But the research is clear, the science is clear, is that there is no link between Tylenol use in pregnancy and autism. There's actually the most recent research study was published in 2024, and that study is the largest. It studied 2.5 million children in Sweden, and that conclusion was that there is no link between Tylenol use in pregnancy and autism.
And so what do you think, as a medical professional who is in the trenches with families and children, what do you think this is about from Washington, D.C.?
Well, I will also be speculating too on that.
We want your professional opinion.
Well, we know that we as physicians, we practice evidence-based medicine. So anything that we recommend to families is based on research. So that is what how we're testing them and the treatment protocols that we're using. And so I'm not sure what they're going to come out with in regards to this report, but if there's any concerns that families have in regards to, what's going to be what will come out, definitely talk to your physician about it, your pediatrician or family physician about it, so that we can go over the report, go over any articles that may come out, and advise them appropriately in regards to what the research says and not what the government is saying.
Okay. For parents out there, pregnant mothers, how serious should they take this if it comes out? Because as you have said, as all the experts have said, there is no evidence to tie this to autism. So what would be your advice to your patients, mothers, pregnant mothers out there?
I would tell them don't panic. I would tell them to speak to their physician, especially if they have fever or if they have pain, because that's why somebody would be taking Tylenol to begin with, right? Is if they have fever or pain.
And if you're pregnant, going to consult with your doctor anyway.
Exactly. So speak to your physician, speak to your obstetrician, so that they can evaluate first, why are you even having fever or pain? And then also they'll be able to tell you, okay, well, this is a Tylenol dose that you should be able to take, because it's actually very important for pregnant women to actually treat the fever and not to leave it untreated, because there is a high risk that they may develop miscarriages or birth defects or preterm labor or birth if they do not treat the fever.
Is that a fear for your industry, that this will scare them to death and some of those symptoms will go untreated?
That is a concern, definitely a concern, that moms and the babies may experience those those effects of not treating the fever. And even not treating pain is important too, because if you don't treat pain, those moms may develop anxiety, may develop depression, even high blood pressure. So it's all of it's important in regards to making sure that the mother is safe and the baby is safe.
All right. Pediatrician Dr. Sharifa Glass, thank you for joining us here on The Factor Uncensored. We appreciate your expertise.